Welcome to this comprehensive lesson on cardiac MRI. In this script, we will delve into the intricacies of this imaging modality, exploring topics such as the basics of cardiac MRI, contrast-enhanced cardiac MRI, clinical indications, and contraindications, essential imaging protocols and parameters, cardiac morphology assessment, myocardial perfusion imaging, functional and viability assessment, magnetic resonance angiography, cardiac MRI spectroscopy, advanced imaging techniques, and safety considerations. So let's begin our journey into the fascinating world of cardiac MRI. Cardiac MRI is an advanced imaging technique that uses magnetic fields and radio waves to visualize the heart's structure and function. It provides detailed information about cardiac anatomy, tissue characteristics, blood flow, chamber dimensions, wall motion abnormalities, valvular function, and myocardial viability. During the examination, the patient lies inside an MRI scanner that generates a magnetic field to align hydrogen atoms in the body. Radio frequency pulses are applied to emit signals, which are detected by receiver coils and processed to create high-resolution images. Contrast-enhanced cardiac MRI involves the administration of contrast agents to improve the visualization of specific cardiac structures and blood vessels. These contrast agents contain gadolinium, a paramagnetic substance that enhances the signal intensity on MRI images. The use of contrast agents in cardiac MRI allows for better delineation of myocardial scar tissue, identification of myocardial perfusion defects, and assessment of myocardial viability. It also aids in the detection and characterization of cardiac tumors, inflammation, and vascular abnormalities. In summary, for accurate interpretation of cardiac MRI, understanding cardiac anatomy, physiology, and blood flow patterns is crucial. Familiarity with myocardial segments, coronary artery supply, cardiac valves, and normal hemodynamics helps identify abnormalities and evaluate pathologies. Cardiac MRI is a versatile tool used to evaluate various heart conditions. It helps in diagnosing ischemic heart disease, cardiomyopathies, congenital heart disease, valvular heart disease, and arrhythmias. However, it is important to consider contraindications such as metallic implants and renal impairment when performing cardiac MRI. To obtain optimal diagnostic images, specific imaging protocols and parameters are followed in cardiac MRI. These include acquiring images in multiple planes, such as short axis, long axis, and 4-chamber views. Different pulse sequences, such as steady-state free precession, SSFP, T1 weighted, T2 weighted, and inversion recovery sequences, are utilized to capture various aspects of cardiac anatomy and pathology. Additionally, parameters such as slice thickness, field of view, repetition time, echo time, and flip angle are optimized to ensure image quality and accurate representation of cardiac structures. Cardiac MRI enables detailed assessment of cardiac morphology, allowing for the accurate measurement of cardiac chamber dimensions, quantification of ventricular volumes, determination of ejection fraction, and evaluation of wall motion abnormalities. It aids in the identification of myocardial and pericardial masses, as well as the characterization of cardiac tumors. By generating multiplanar reformatted images, cardiac MRI facilitates the evaluation of cardiac septal defects, congenital heart diseases, and abnormalities of the great vessels. It also plays a significant role in assessing the aortic root, aortic valve, and other valvular structures. During myocardial perfusion imaging with cardiac MRI, we examine blood flow in the heart muscle at rest and during stress. This helps us detect areas with reduced blood flow, ischemia, determines viable heart tissue, and assists in planning treatment for blocked heart arteries. Functional assessment of the heart using cardiac MRI involves the evaluation of myocardial wall motion and contractility. It aids in identifying regional wall motion abnormalities indicative of ischemic heart disease or cardiomyopathies. Viability assessment, on the other hand, determines the presence of myocardial scar tissue using late gadolinium enhancement, LGE, imaging. LGE images acquired 10 to 15 minutes after contrast administration highlight areas of myocardial fibrosis or infarction, helping in the differentiation of viable and non-viable myocardium. Magnetic resonance angiography, MRA, is a non-invasive technique that visualizes blood vessels and provides detailed information about their anatomy and flow characteristics. In cardiac MRI, MRA enables the assessment of the coronary arteries, aortic arch, pulmonary arteries, and other major vessels. By using specialized imaging sequences and contrast agents, MRA can identify stenosis, aneurysms, dissections, and other vascular abnormalities. It plays a crucial role in preoperative planning for cardiac surgery, evaluation of congenital heart disease, and follow-up of vascular interventions. Cardiac MRI spectroscopy is an advanced technique that allows for the assessment of metabolic function within the myocardium. By using specialized magnetic resonance spectroscopy sequences, it provides insights into myocardial energetics, metabolism, and substrate utilization. Cardiac MRI spectroscopy has applications in the evaluation of myocardial viability, detection of metabolic abnormalities in cardiomyopathies, and assessment of response to therapy. It can measure metabolism-related parameters, such as creatine kinase and high-energy phosphates, providing valuable information for diagnostic and prognostic purposes. In recent years, several advanced imaging techniques have emerged in the field of cardiac MRI, enhancing its diagnostic capabilities. These techniques include quantitative myocardial tissue characterization using T1 and T2 mapping sequences, diffusion-weighted imaging for assessing myocardial microstructure, and strain imaging to evaluate myocardial deformation. Furthermore, techniques like whole heart imaging and 4D flow imaging offer comprehensive evaluations of cardiac anatomy, hemodynamics, and flow patterns. These advancements have significantly contributed to the diagnosis and management of various cardiovascular conditions. Safety is of utmost importance when performing cardiac MRI. Magnetic fields generated by the MRI scanner can interact with metallic objects, causing potential hazards. Therefore, careful screening of patients for metallic implants, pacemakers, defibrillators, or other devices is crucial before the examination. Additionally, certain conditions, such as claustrophobia or severe obesity, may require special considerations and accommodations. The administration of gadolinium-based contrast agents should also be carefully evaluated, especially in patients with renal impairment or a history of allergic reactions. In conclusion, cardiac MRI is an important tool for diagnosing and managing heart conditions. It provides detailed information about the heart structure, function, and problems. It helps doctors accurately evaluate the heart's shape, blood flow, and how well it's working. Safety precautions are important when using this technique. I hope this information has been helpful. Thank you for learning with me, and keep exploring more about cardiac MRI.